Hello everyone. I'm here to present a demo of Einstein Prediction Builder, focusing on fever patient healthcare use case. Our objective is to predict the likelihood of patients' hospitalization based on their present medical conditions. To achieve this, we will utilize a custom Salesforce object named patient. Now let's delve into the specifics of Einstein Prediction Builder, tailored for fever patient healthcare scenario that we have implemented. The name of our Einstein Prediction Builder is Hospital Admission Probability Predictor, and it falls under the category of numerical type. We are utilizing a custom Salesforce object named patient, and we are not segmenting any records. Let's talk about the input and output settings, which are very essential for this process. In input settings, we determine example records or example set. Now, what constitutes an example set? Records from which our machine learning model learns. To train Einstein, we have to specify examples of prediction outcomes to predict. The closer the match, the more accurate your predictions can be. Now, here we have to decide on a field that determines the outcome we are predicting. For this purpose, I have selected the admitted rate. These fields hold the admission chance or probability of hospitalization for the corresponding example records. And at last, we are utilizing all the records that have an admitted rate, while thoughtfully excluding all the records that do not have admitted rate. Moving on to output settings, let's talk about records to predict. Here we are aiming to predict all the records that don't belong to example set. Now for score field, we have created a custom field named hospitalization chance. It will contain the score predicted by Einstein. This is a numerical value associated with each prediction. And now let's proceed to scorecard or report generated by Einstein. As you can see, our prediction quality is too high. The quality of our prediction is 98. Now, what is prediction quality? The prediction quality is calculated before our prediction is applied to live data. It is estimated using a subset of data from our example set. The actual quality of predictions might vary when applied to live data. And here you can see our top predictors, which are medical history, blood pressure, allergy. Let's see this in live action. As we can see here, we have created a list view and named it Hospital Admission Probability Tracker. Here is hospitalization chance, Einstein predicted score field. Let's open any record. Adrian Carter. And Einstein says that there are 87% chances that this patient will be admitted to hospital. What are the top predictors? Medical history, blood pressure type, past medication, symptom as well as allergy. If we come to our medical issue details, patient is having symptom, patient is also having blood pressure, patient is having allergy, as well as patient is taking a past medication, which matches to our top predictors. That means there is high chance that this patient will be admitted to hospital. Now let's go to a patient which has least chance of getting admitted. Isaac Hood. We can see here the patient is having a little chance of going to hospital. Why? Because patient is not having any allergy, patient is having a symptom, patient is not having any medical history, patient is having a normal blood pressure, and patient is also not undergoing through any past medication. As we can see in medical issue details, symptom we are having, but other conditions we are not having any medical history, we are not having allergy, and we are also not having any past medication. So that's why this patient has least chance of getting admitted to hospital. And this is how it works. Thank you.